Tony?
Yeah, just very quick. I mean, you spoke about financial envelopes and that. Imagine you're talking about efficiencies that have got to be made over the next up to 2014, 2018. So what are we talking about? What kind of savings?
The Sustainability and Transformation Plan identifies that if we continue with our current utilisation rates and our current trajectory on finances, that it's about £1 billion for the whole of Cheshire and Mersey. At the moment, we are working with a number of CCGs to look at how they can manage their deficits over the next 2 years to their plans. But of course, we're really mindful that we want to be sure that they don't, that whatever they plan in the short term doesn't undermine the intentions of the Sustainability and Transformation Plan and your local LDS in terms of focusing on trying to, in the broader sense, reduce demand by focusing on creating more wellness rather than continuing with the trajectory we have around ill health. So it's going to be, effectively, the recovery planning is the short to medium term part, at which point the expectation is that collectively across Cheshire and Merseyside, working together across that, the whole of Cheshire and Merseyside will get the whole of Cheshire and Merseyside into a sustainable position.
Okay. Just one from me, Nicola. You may not be able to answer this, but as part of Liverpool City Region's Round 2 devolution period, we're looking at health and social care, and we're looking very closely at what Manchester is doing. I'd just be interested in if you've got any knowledge of what they're doing, where they're up to, and what their model looks like.
I'm really sorry I
You
haven't,
don't
not in
know.
terms of the detail. In
Okay.
fact, we haven't completely, what I can tell you is we haven't completely handed over yet. So, for example, Graham, who's the Johnstone counterpart of the GM Lancashire, hasn't formally as yet withdrawn entirely from Greater Manchester. So they're still very much in transition. He'll be doing that very shortly, but he's kind of not there yet. So I think my looking at the outside is that they're still very much working through their governance arrangements and so on.
I mean, I just think at some point in the future it might be useful for us as a board to look at the devolution journey around health, because it's key, really, isn't it? And it's something that we're exploring in the Liverpool City region. So.
Yeah, absolutely, and I think the earlier we can start to kind of pull out messages and so on, the better, really. So I'd be really happy in a development session where we were able to be informal and so on. Which really happy when I thought time was right to kind of share the lessons, anecdotes and so on that might help inform thinking.
Okay, I think that'd be really useful. Yeah. Okay. Anything else? Any other points or questions for Nicola? No? Okay, thanks very much. Right, so that takes us on to item 6, Wirral Health Protection Group, annual reports. Fiona?
I'll start this off. Rachel Wolfgrave, who's the lead health protection lady, is in attendance, and hopefully if you have any detailed questions, we'll be able to answer some of those. But just to put it in context, why is it here? Well, the health protection group on Wirral is a subgroup of this committee. So we work in terms of the health protection statutory responsibilities. We needed to be clear on what the issues were on Wirral
we can look particularly around some improvements in those areas. So if I talk through those 8 priorities to you and some of the rationale, the detail in terms of this report and how we'll do some of that is included within the back of the appendix. So if you've got some specific questions around the action plans to deliver that, well, I will take those. So reducing foodborne illness is one of the priorities, mostly because it's one of our most prevalent infectious diseases, probably because it's a very common infection. But it does put a lot of pressure on the system, and we've seen that in terms of D&V outbreaks in care homes and how that impacts on our local care system as well as a consequence. Secondly, seasonal and pandemic influenza, although they are two very different beasts, they have a huge impact in terms of, on a seasonal basis, our local health and social care system, and on a pandemic level, there's a real societal impact as well. So that work is really about, in terms of seasonal flu planning, preparing and mitigating for knowing what we know will come ahead. And pandemic is about preparing for all eventualities if a pandemic does occur. And obviously we need to be prepared for both of those things, which is why it's a priority for the group. The third priority is around tackling the growth in antimicrobial resistance. So that is, we know that the use of antibiotics has been increasing, and as a consequence to that, we're now seeing infections that are resistant to those antibiotics. And that is an issue for Wirral because we have extremely high rates of prescribing of antibiotics across Wirral. And that then has an impact on increasing rates of infection, but also our ability to treat those infections. So it's a really important issue for Wirral. And that is kind of connected to priority 4, which is around reducing our incidence of C. difficile. We do continue to have high numbers of cases of C. difficile. This year we've again exceeded the threshold imposed upon us. And there is a big piece of work that's been undertaken to try and reduce those rates. And I'm pleased to say actually that work that we've been doing over the last 6 months, we've already started to see some reductions on that. And that has again been a real team effort across the local system to try and drive down some of those numbers. Protecting the health of care home residents is also tied into those 2 previous priorities as well. We know that people living in care homes are particularly vulnerable to infections, particularly infectious disease. So anything from seasonal flu right through to those healthcare-acquired type infections. And so most of our C. diff is amongst older people and particularly people living in residential care homes. Number 6 is around reducing variation in cancer and diabetic retinopathy screening. On the whole, we're all performed well in terms of our screening uptake. However, we do know that there are differences in terms of the uptake of screening across Wirral practices. So we really do need to do some work to try and look at that variation across the patch. And that makes a really important contribution around health inequalities and early diagnosis of really some important health issues. Similarly, priority 7 is related to vaccine uptake, and much like screening, whilst we're performing well, we also see some variation across the patch. So we know in some practices uptake is very good, and in others it's not so good. And particularly looking at the range of vaccines in the schedule, we know that pertussis vaccines, that's whooping cough for pregnant women, is particularly poor, and we do know that there has been cases of a Wirral baby that has had pertussis infection as well. So that's a really important priority for us locally, as is ensuring that our under 5s are fully vaccinated before they enter school, and that's really important in terms of our broader priorities around readiness for school. And finally, and crucially, it's a priority because it's an absolute must that we do it. We need to ensure that our emergency planning and resilience around protecting health in terms of those threats is absolutely planned for and prepared for and as integrated across the system, which is absolutely why it's our final priority in this report. And we hope that these priorities, whilst the Health Protection Group cannot be independently responsible for delivering those, it is a forum through which it can drive these priorities across our local system, ensuring they're embedded into what people do as usual business and into commissioning plans. So those are the priorities. I hope that gives people enough of an overview. I'm sure that I hope you've had opportunities to read the report, and I'm happy to take any questions.
Okay, thanks, Rachel. Should we open up? Anybody want to hold? What's your hands going?
work to be done both with professionals but also with the public in terms of understanding the issues around antimicrobial resistance. So there is a plan in process. In the meantime, Public Health have really been trying to drive some work around doing some public kind of insight work and also a full front-facing campaign to really support people to understand what some of the issues, because I think some of it is a bit jargonistic and we do need to support clinicians in terms of providing those messages. I think there are some other quite specific tasks that we're looking to our clinicians to undertake. So it's things like backup prescribing. So if you go to your GP and you feel a bit unwell, that actually they'll say go away for 3 days, I think it's viral, see how you feel, and they've got a bit of a safety net, so they've got some information if you've seen any of these red flags, come back to us. And that's been seen to be effective in other areas, so we're hoping that we can roll out that approach locally. But I think we're still in the early stages of working through that plan. But my understanding is that we should have an action plan by September.
Thank you very much. Okay, Lesley?
Can I just ask about the use of sort of modern technology and mobile phones particularly? I mean, I'm aware that there's a patient access app that you can get for your mobile phone, which clearly is probably used by most of us for doctor appointments and seeing where the availability is. But I particularly, get reminders about, coming here and blood pressure checked, and I suppose a lot of them will depend on the age of the patient really, but particularly in perhaps reducing costs as well. The likes of bowel screening, I mean, again, age significant really when you start getting reminders and people haven't taken it up, they keep sending you letters. So therefore, if they were to use modern technology by way of trying to encourage people to have this patient app on their phone, you could get that. And also with the vaccinations as well for children and information sharing. Only today there's a lot of information on the media about the use of certain vitamins and whether or not they're useful or not for pregnant women maybe. And rather than perhaps people sitting at home wondering or waiting until they meet their midwife or health visitor, have we got the data? Is it actually scientific enough, the data, and can it be broken down to try and target some of those people? And as I say, not only giving them more awareness, but as well, we're talking about the cost and clearly everything, the escalation of that is saving money as well. Perhaps to take them a little bit more. How does that work at the moment?
So I think it's a good point you make, and the use of technology is absolutely one of the ways in which we would suggest is effective in terms of increasing that uptake, particularly in, as you say, certain groups. So we've done some work, quite a lot of work around cervical screening, and certainly the issue of technology and how it's communicated has come up as a kind of helpful way. And there are some examples of practices across Wirral that use that technology to remind people about appointments. Some of it is tied up into how all the bits of the system join together, and I don't know whether Nicola has a view, but in terms of the processes for kind of inviting people for various kind of screening opportunities, some of that is done centrally. So practices, are reliant on developing systems that align with that as well. But it's certainly one of the ways in which we would look to try and increase the numbers taking up screening as a useful reminder.
Nicola, do you want to answer that?
Only one of the big functions of the Acton Health Science Centre
vitamin, medication used here in this authority. I know it's quite widespread in the whole of England, but we use, so we seem to have a history of sort of giving out medication from a very young age, really. And so, interesting just to, in comparison with other places. Interested to know what percentage of children under 5 are actually being vaccinated. Do we have those figures actually? So what percentage is it?
I don't know the figures off the top of my head, but we can certainly send you those.
Because I think that's quite crucial, isn't it, really, to know if we're talking about a very low figure, 13%. And I'd like to know the different areas as well, the different sort of constituencies.
So, what we do know, actually, there is a, I don't know what page it is. There's a page which actually shows all our indicators.
Just the page before where you would be looking, so page 13 of the report, page 7.
And what I would say is, it sounds like you said vaccination is a really important priority, but we're actually performing really well. We're above, again, where we need to be. We just think we can do better. So we're exceeding 90% across most of the vaccines. But I think what's quite complicated is it separates all the vaccines up individually. So you'll see a report and a number for each vaccine. But actually overall, again, it's a good news story. We're definitely up there, but we think that we can do better. We don't want to see children without critical vaccines. So we want to push that as hard as we can and get beyond that 95% figure.
Will it be possible to have a breakdown of these sort of constituencies and that, sort of policy back in there? Is that possible? Because
It's generally collected by practice. We get coverage data by practice. It's difficult to break it down by a number because we don't hold the data and it's provided to us. It's actually held by, which is in helping. So who work with us, I have to say, to help us. But so we can see variation across the borough, and that's why, as Rachel said, we're not comfortable everywhere in the borough is at that average level, and that's what our aspiration is. So to drive out any variation, but we have to develop a map to be able to show where it is. We can't necessarily do it by constituency, but
Okay, Phil.
I was looking at the question of care homes. It is 20 years since I worked in a care home, so I'm not up to date with practices. I wanted to ask about the section about planned actions about care homes based on need. The last table I saw care homes was one that had a list of about 80 odd care homes and put the CCG, the care quality inspectors breakdown into good, inadequate and so on. And that raised some troubling proportions, but I know DAS keep a sort of record of red, amber, green and whatever, which the cabinet member, I'm sure, scrutinises all the time about how well the homes are doing. But the aspect of care homes and prevention of infection, the committee is based on needs. So how do we judge that? If there's an outbreak in a home, there's sort of statutory notification to you about we've got this problem, and then let's say the troops rush in and give them advice. But there is an intention in this about trying to promote good practice before we ever get to that bad stage.
Yeah, so you're absolutely right. It's a combination of those two processes. So there is a preventative element of this. So a lot of the work of our community infection control team, which is delivered by Wirral Community Trust, is to look at exactly that, working with care homes, preparing them for potential infections. So it would be things like seasonal flus, but also diarrhea and vomiting outbreaks. And this year we've actually looking to develop an enhanced package around that. So we're devising a quality improvement programme, so going beyond auditing to make sure that a care home has everything and is doing everything it can around infection control. We're actually looking at how we can support them in relation to training, any policies they might have. We're observing practice to support them in terms of how they could do things better. So we're trying to do that from a preventative angle. When an outbreak does occur, there is work that happens between, again, partners. So PHE, Public Health England, will work with our local community infection control team to kind of minimise the impact of that. We know that we were hit particularly bad this year, as we sometimes are, and that obviously had an impact on our acute hospital as well. So it's a really important thing for us to be able to get a handle on, and obviously for the patients in those homes, it's really distressing and not very pleasant at all to be experiencing that. So we also participate in the DAS work looking at policy improvement in care homes. So we're also sat at the table looking at those policy issues alongside colleagues across the council. So we're not separate from the work that DAS is doing, we're part of that as well. And we're linked into some of the work that the CCG colleagues are doing around